All right, today we're diving into a really potent non-narcotic pain reliever. It's a total game changer for short-term, pretty severe pain. We're talking about Ketorolac, though you probably know it by its brand name, Toradol.
So, have you ever wondered, what do doctors reach for when the usual over-the-counter stuff just won't do the trick, especially when they want to avoid opioids for managing some pretty serious pain? Well, that's exactly what we're getting into today.
But before we go any further, there is one golden rule that defines absolutely everything about this medication. 5, as in 5 days. Trust me, by the end of this, you will understand exactly why that limit is so incredibly important.
Okay, let's kick things off with Section 1, Meet Ketorolac, aka Toradol. We're going to take a much closer look at what this powerful pain reliever actually is and how it gets the job done. So what is this stuff? Ketorolac is what's called a non-steroidal anti-inflammatory drug, or you've probably heard the term NSAID. It works by going right to the source of pain and inflammation. Think of it like this. Your body sends out these little chemical messengers called prostaglandins when something's wrong. Ketorolac's entire job is to block the production of those messengers, basically cutting off the pain signal before it even has a chance to start. Pretty clever, right?
And you know what? It works fast. I mean, we are talking about it starting to kick in within just 10 minutes. And once it's working, a single dose can give you relief for a solid 6 to 8 hours. For a non-narcotic, that's some serious power and staying power.
Okay, moving on to Section 2. This is where that 5-day rule really starts to make sense. We're calling this the 5-day pain mission because it's all about understanding its very, very specific purpose.
And here's the bottom line. Ketorolac is not for your everyday tension headache. Its main approved job is for the short-term management of moderate to severe pain. And when we say short-term, we mean it, less than 5 days. Now, interestingly, there's an off-label use for it, helping to manage fever in kids after they've had a febrile seizure.
All right, this next part is hugely important, so listen up. Section 3, red flags. Who absolutely needs to stay away from this medication? Let's go over the critical safety contraindications. And I'm not kidding around here. Because this is such a powerful tool, it comes with some really strict safety rules. The information we're about to cover is vital for anyone who might be prescribed this drug or is even just curious about it.
So first on the list is a group of issues all related to sensitivities and bleeding. You absolutely cannot take Ketorolac if you know you're hypersensitive to it. Same goes if you have allergies to aspirin or any other NSAIDs. It's also a hard no for anyone with an active peptic ulcer or any kind of bleeding disorder. The risk is simply not worth it.
And the list of red flags continues with some major health situations. It is off-limits for anyone with severe kidney problems, or if a doctor even suspects there might be bleeding inside the brain. It's also forbidden right before a big heart surgery, like a coronary artery bypass graft. And finally, it's contraindicated for women who are in active labor or are breastfeeding.
Now let's dig into the risks a little deeper. In Section 4, we're going to break down the difference between side effects, how your body might react, and dangerous drug interactions.
Okay, so you can see there are two kinds of danger here. Over on the left, you've got potential side effects. These can be relatively common things like a headache or nausea, but they can also be more serious issues like sedation, swelling, which is called edema, bleeding problems, or even a life-threatening allergic reaction known as anaphylaxis. Then on the right, you see what can happen when you mix it with other stuff. The big no-nos? Don't combine it with other NSAIDs or aspirin, and you have to be incredibly careful because it dramatically increases bleeding time if you're also taking anticoagulants. You know, blood thinners.
So how do you actually get this medication? That brings us to Section 5, how it's administered. And if there's one word to remember here, it's precision.
As you can see from this chart, this is not a one-size-fits-all situation. A typical adult might get 30 milligrams injected into a muscle or between 15 and 30 milligrams through an IV. But, and this is a big but, look at how that changes. For patients over 65 or anyone who weighs less than 50 kilos or has kidney issues, the dose gets slashed in half down to just 15 milligrams. And even for kids, the dose is super carefully calculated based on their body weight. That kind of precision just goes to show you how potent this stuff really is.
All right, let's wrap this all up in our final section. Section 6, the bottom line. We're going to cover the most important takeaways and a few very special considerations you need to know. And if you want to understand just how serious these warnings are, listen to this direct quote. It says, use of Ketorolac during labor and delivery is contraindicated because it may adversely affect fetal circulation and inhibit uterine contractions. That's not a gentle suggestion, it's an absolute prohibition. It really highlights the profound and sometimes dangerous effects this drug can have on the body.
So, what are the crucial points to burn into your memory?
First, Ketorolac can cause sudden, unpredictable drops in blood pressure. Second, it has to be used with extreme caution in older adults. And finally, for anyone with a history of liver, kidney, or gastrointestinal problems, extreme caution is an absolute must. When you step back and look at it, Ketorolac is an incredibly potent weapon in the fight against pain. But it's a weapon that demands the absolute ultimate respect from both the doctors who prescribe it and the patients who receive it. And that really makes you think, what does this constant balancing act between powerful relief and significant risk really teach us about the trade-offs we make in modern medicine?